Good morning, everyone. We're here to announce a very, very exciting new opportunity for the state of Rhode Island. That is the university's receipt of a grant totaling $14 million from the U.S. Department of Health and Human Services Center for Medicare and Medicaid Services. The grant is entitled Living Right, a disruptive solution for management of chronic care disease.
This is an extremely competitive process that we went through to be here today. And Associate Research Professor Elaina Goldstein did a terrific job in putting together a proposal that could compete with 3,000 others and be one of the 100 selected for an award. And I think that speaks very, very highly of the quality of the faculty at the University of Rhode Island and the stature of the University of Rhode Island, the talent and energy of the people of the University of Rhode Island, that we're able to compete for these kinds of awards on a national level. This is economic development and job creation, as well as being research and healthcare delivery advances. And that's, I think, incredibly important for all of us in Rhode Island as we look and work together to try to rebuild the economy of Rhode Island. I think this makes the point, a point that I've made many, many times, that the University of Rhode Island is an economic engine for the state of Rhode Island, that the University of Rhode Island provides opportunities for the people of Rhode Island, that it provides opportunities for economic renewal and economic rehabilitation of our state, and the research activities of the University of Rhode Island can, in fact, help all of the people of Rhode Island to a better and brighter future, not only by virtue of the actual work that we do, but by virtue of the many positive economic impacts that result from that work.
This saves money. The federal government is spending money in order to save money. It's spending money in order to provide better care, and through better care, provide a lower cost solution for patients who might otherwise be getting a lot of unnecessary and conflicting care. So this is the best kind of savings. This is savings that come from improved performance, not savings that come from taking things away from people. So that second point I want to make is that the so-called dual eligible population that this will serve is people who qualify both for Medicare and Medicaid. These are people who have a lot of poverty in their lives. They have a lot of illness in their lives. In the case of this group, they will also have cognitive impairment that will create a hazard and an obstacle for them in dealing in a appropriate way with the healthcare system. And so it's a really, really strong target area. They use a lot of services, and if they can be directed in a more sensible and better way, again, back to the first point, they will receive better care at a lower cost to the taxpayers in a huge win-win. This is a big day for the University of Rhode Island. It is a big day for Rhode Island, and in a larger sense, it is a big day for Rhode Island's nationally recognized leadership in this area of delivery system reform in healthcare.
The development of a mini clinic will allow more immediate access to medical services that are provided by medical professions who know the person and have access to all of their medical records. A very exciting result of this grant is the building of an interdisciplinary team around the person. The opportunity for physicians and specialists to work directly together as a team will provide better coordination of care by building a circle of support around the person.
As much as this is a healthcare grant, it also is a workforce development grant. And one of the things that I think that we did that was probably a little bit different than most of the other grants was, as the Provost said, I've been spending the last 11 years attempting to get people with disabilities into competitive employment and to help change our system in the state and work with employers and with the state. And that means that everybody who will be hired out of this grant, except for probably my staff, but everybody who will be hired in healthcare professions and they will be hired in new community health worker professions, peer support people, will all be people with disabilities. And for a total, I think, of like 31 people will be hired that have disabilities working in the healthcare system, and hopefully having more people with disabilities be able to work in our healthcare system for the future. This is a partnership. There is no way that we are going to be we weren't able to get the grant, and there is no way we're going to be successful without the partnership of all of the private sector, of the people with disabilities, of the providers, of the state agencies to really make this happen. But I am incredibly encouraged. We have a wonderful partner in CMS. I have a great project officer, and I'm really looking forward to 6 months from now to have a ribbon cutting ceremony here, Tom, where we can all come back and see this place happen with people who are being served because of Living Right. Thank you.